Now I would like to ask Toni Dubeau to give the last presentation. She is a research nurse and a nurse practitioner in Dana-Farber Cancer Institute, and she will talk about self-management, fitness, supplements, diet and fatigue. So this is for the neck, and this is the... okay.
Hello, everyone. My name is Toni Dubeau. I'm a nurse practitioner at Dana-Farber Cancer Institute. I have a long history working at Dana-Farber in hematologic malignancies, mostly with allogeneic stem cell transplant group, but have been a nurse practitioner working with Dr. Castillo now for about a year. And I am happy to be here talking to you as well, representing the nurse's point of view on treatment and care of a patient with Waldenstrom's. So you can't talk about Waldenstrom's without talking about being tired, really tired. I think this guy here looks pretty much down and out. So fatigue and Waldenstrom's, anemia-related fatigue is a common presenting symptom for patients with Waldenstrom's and is in fact the most common criteria we use to initiate treatment. Anemia is related to the bone marrow infiltration by the lymphoplasmacytic lymphoma cells, which interfere with the normal production of red blood cells. Anemia is related to hepcidin, which is an important regulator of iron homeostasis, and excess production of hepcidin blocks the absorption of iron in the GI tract. Hemolysis caused by cold agglutinin also can cause anemia, and hemolysis is the breakdown of red blood cells. So I believe that, well, fatigue is a subjective symptom. I can't tell you how fatigued you are, and fatigue is quantified based on how much it interferes with your day-to-day activities. So the National Comprehensive Care Network, they develop guidelines for the treatment of cancer and its symptoms. They define fatigue, and I think it's important to define it because everybody can say, I'm tired. And fatigue is a distressing, persistent, subjective sense of physical, emotional, and or cognitive tiredness or exhaustion related to cancer or cancer treatment that is not proportional to recent activity and that interferes with your function. Again, fatigue is the most common symptom to be reported, to interfere with the activities of daily living, and this fatigue lasts longer than you would expect, longer than treatment-related side effects. But fatigue isn't always related to Waldenstrom's, so we need to be careful before we treat fatigue that we do a proper workup in order to demonstrate whether there are alternative reasons for people's fatigue. Anemia can be related to other things as well. It can be related to iron deficiency, vitamin deficiencies such as B12 and folate, and always we have to look at GI bleeding as a possible reason for anemia. Thyroid dysfunction can make people feel tired, so hypothyroidism, and those studies should be checked. Sleep apnea is something we actually not uncommonly find in our patients, and it results when the airway is obstructed during sleep, and people can wake up dozens and dozens of times during the night and be unaware of it and be fatigued upon waking and fatigued throughout the day. So we often recommend sleep apnea testing for our patients. Sleep hygiene is something that we talk about. It's new, and it's something that people talk about in relation to insomnia and fatigue. So your sleep environment should be quiet and dark and comfortable. You should avoid stimulants such as alcohol, caffeine, and cigarettes, which might rev you up before you sleep. Avoid eating heavy meals before sleep. Exercise promotes fatigue, doesn't interfere with it, so it's recommended. Napping during the day will interfere with proper sleep and the use of electronics as well. Depression is a common symptom that can be culprit in patients' fatigue, either somnia, which is too much sleeping, or insomnia, which is unable to sleep. Pain, obviously, for those of you that have peripheral neuropathy or pain, chronic pain, you know that that can interfere with your sleep. In men, we need to look at testosterone levels because low testosterone can cause fatigue. And always we need to do a proper review of patients' medications because things like beta blockers for blood pressure and heart function can make people tired, as well as narcotics and other pain medications that we use, antidepressants and anti-anxiety agents, and antihistamines as well, and others, I'm sure. So just a little bit more on electronics. We're also addicted to our phones and our computers these days, but there is information that electronics emit blue spectrum light, which disrupts the production of melatonin and interferes with your sleep. So really, proper sleep hygiene dictates that you should turn off your screens at least 1 hour before you go to bed. It's also stimulating as well. So again, the NCCN guidelines for fatigue management, there are some listed here, and there are strategies that are general and are meant to conserve energy, to delegating tasks, using your upfront energy in the morning to go about your important business of the day, and then resting before you again engage in activity in the afternoon. Pacing yourself, which is what we're talking about, and then limiting naps. So if you're sleeping for 4 or 5 hours during the day or taking a 2-3 hour nap, you're going to be less tired at night and sleep less well. So limiting naps to less than 1 hour, power naps in fact. Physical activity is something that I'm going to talk more about, but it is in the NCCN guidelines as a recommendation for the treatment of fatigue. There are pharmacologic interventions for fatigue, and they're worth mentioning, but again, if we can use something natural and healthy, like exercise, as opposed to using stimulants such as Ritalin or medications to treat pain and depression. Obviously, improving sleep hygiene is important in using sleep medications when necessary. So there are some, I looked a lot at the literature in relation to exercise and fatigue, and there's a lot of data out there. In the course of my meetings with patients, I always talk about exercise, and it's well validated when you look at it. These are really systematic reviews done by different researchers. The first is a review done by Lavoie and colleagues in the United States, and it suggests that fatigue is a result of chronic inflammation from the overproduction of pro-inflammatory cytokines, which are proteins, and beyond that, they looked at exercise in dozens of randomized studies with thousands of patients and found that exercise positively impacted patients' fatigue and quality of life. They confirmed or validated that moderate to high intensity exercise worked best and that it was well tolerated. The second study is from the UK, Gerritsen, and they validated that upon looking at many randomized trials that exercise had a direct positive impact on fatigue and quality of life. And the third trial is from Germany, or the third article is from Germany, and they looked at the efficacy and the safety of exercise. These are all research articles on patients with cancer, and Bergenthal from Germany found that exercise was safe and efficacious for patients with cancer. And interestingly, here in the Netherlands, they looked, a patient, or the researcher Rokel looked at sedentary behavior as a risk factor for fatigue. So, and their research confirmed that greater sedentary time, couch time, downtime was associated with lower physical functioning and more fatigue and decreased quality of life. This is from the Lavoie, the first article that I mentioned, and it's an article that, image that, a diagram about cancer-related fatigue being related to systemic inflammation, and that exercise reduces those pro-inflammatory cytokines and increases the anti-inflammatory cytokines, has a direct effect on skeletal muscle, and reduces fatigue. So, in the US we have guidelines. We have guidelines for health, and these are the 2008 physical guidelines for physical activity. The recommendation is for at least 30 minutes of moderate intensity physical activity 5 days a week, 150 minutes total. Or if you're engaging in vigorous activity, 75 minutes of vigorous intensity aerobic activity 3 days a week. They recommend muscle strengthening, weights, gentle muscle strengthening, 2 or more days per week. And obviously we must take into consideration your health and any other comorbidities, but really everyone can exercise. It's a matter of finding a place to begin and going from there. We have patients with peripheral neuropathy that interferes with their balance and really their function. And there are times, I think, when it's appropriate to refer to a physical therapist as a place to start to gain some strength and move from there. Everybody knows what exercise is, but really walking, biking, yoga, going to the gym or not. Many people don't like the gym, but you can do exercise at home and do what you like to do. I think that that's important. If you don't like it, you won't do it. And also, I think as we exercise and we build upon it, it becomes something that sustains us and makes us feel better in our brains as well. So yoga is a practice that is more than 5,000 years old and rooted in the ancient Indian culture. And it combines exercise with breathing and meditation. And there are, again, I looked at the literature and a number of reviews which validated yoga's effect on psychological as well as physical well-being, quality of life, emotional, social function. Yoga, people sometimes have an image of yoga that people are doing headstands and the splits, and they're, doing these crazy poses that, break your bones. But any good yoga instructor knows that any person doing yoga starts from what is comfortable for them, that the stretches should be gentle. And I think that the mental component, the settling down of the brain, which helps reduce anxiety and stress, is really an important part of yoga and can't be understated. And for people who are undergoing therapy and worried about diagnoses, this is a very effective tool. So, I was asked to speak about nutrition, and I looked a lot at nutrition in the context of obesity in patients that we take care of, not cancer patients specifically, but it's something that I feel strongly about. Patients ask, what diet is the best diet for me? People go on very specific diets, or anti-cancer diets, macrobiotic diets, diets specific to blood type. People are interested in the newest thing, but really there is no special diet for cancer. The diet for any of us and all patients with cancer is really an overall healthy diet that is rich in fruits and vegetables and lean proteins. Whole grains, low-fat dairy products. This is not something that you don't know, I don't expect, but limiting saturated fats, red meat, sweets, sugary beverages are the greatest contributor to obesity in our country. But healthy, real food, prepared food from boxes with preservatives and salt, I don't recommend, and I don't think is good for most of us. So cooking real food. This is from that's from heart.org. This is just an image that I like, that for patients that and people that don't know how much food they're supposed to eat every day, is just very straightforward. Half of your plate should be fruits and vegetables. Fruits and vegetables, 5 to 9 servings per day, and only about 25% of people in my country get the recommended amount of fruits and vegetables a day. Proteins should be lean, and grains and legumes should be on the plate as well, and they should be whole grains, things that are brown. The Mediterranean diet is a diet that is thought to be healthy, and lots of people like this idea. It's not very different from what we just talked about. Plant-based diet, healthy oils, using herbs and spices instead of salt, limiting red meat, and eating lean proteins. But I like this idea that we should enjoy our meals with family and friends. So many of us eat fast on the go in front of the TV without thinking about the food that we're eating. And part of this recommendation is to eat and enjoy your food and drink wine, which is good, in moderation, and also get plenty of exercise. So this is people probably have seen this as well, but this is a pyramid for the Mediterranean diet, which is a little bit different than the typical one you might see. And on the bottom, you see that all the food should be based on a lifestyle that includes physical activity, and eating with those you love and enjoy, and then plants and grains and lean proteins, and red meats and sweets are the least large part of the pyramid on the top. So this is the other thing we get asked about a lot. We get asked a lot about supplements and what I can take to make me healthier or better or this or that. And there isn't that much that we recommend that you take, but I'll go through it here. So vitamin D promotes calcium absorption in the gut. It's needed for bone growth and remodeling. Vitamin D deficiency has actually been linked to fatigue, so having adequate vitamin D levels is important. Levels should be checked by your oncologist or your physician. Sources of vitamin D are sun exposure, which we limit and we block with sunscreen. Foods might be fortified with vitamin D, and supplements. We do recommend, if you're deficient, a vitamin D supplement in an amount of 1,000 to 2,000 international units per day. Calcium is also important for lots of functions of the body, including vascular contraction, vasodilation, muscle function, nerve transmission, many things. Principal sources of calcium are milk, dairy, and cheese. If you're not getting adequate calcium in your diet, we recommend 1,000 milligrams per day. There is some controversy around calcium and women and heart health, but it's not completely clear, and I just recommend that you seek the advice of your physician as to whether it's appropriate or not. So also when you talk about Waldenstrom's, you have to talk about, for some people, peripheral neuropathy, as you've heard, is an issue, and there are some supplements that can be helpful. Alpha lipoic acid is one. It's an antioxidant and can be helpful for neuropathic pain in the dose of 200 to 500 milligrams twice daily. Generally, I would say about 600 milligrams per day. Acetyl L-carnitine is an amino acid, has neuroprotective functions, and it is an antioxidant as well. Can be taken in combination with alpha lipoic acid, and recommended doses up to 2,000 per day. Fish oils, omega-3s, you get them in fatty fish, which is good for you, but you can also take it orally, and it is thought to have neuroprotective effects as well. It should not be taken with ibrutinib if you're on ibrutinib because of increased risk of bleeding. So somebody asked about muscle cramping. Sorry to not be looking this way. I don't read Dutch. But muscle cramping is an issue for some people. It's a hard thing to treat effectively. It's intermittent. So taking pain medicine or something that will affect you in an ongoing way is maybe more than you should be doing. Magnesium may help muscle cramps. You can get this over the counter and take an extra dose of magnesium. I have had patients, when I worked in stem cell transplant, I had patients who had a lot of disabling cramping, and some of them actually used magnesium oil and rubbed it into the area where the cramping occurred. Potassium may be beneficial when people have cramps. Again, you can get it through bananas, oranges, apple cider vinegar, but potatoes, various things. But it's not something that works for everyone, either of these things. Calcium, again, some people believe calcium can help. The one thing that has research behind it actually is quinine. So there is research that says that quinine is effective for the treatment of muscle cramping. You can get it in an oral dose, but it's known to have it can have some effects on blood. And so most practitioners won't prescribe it, but you can also get quinine in tonic water. And so this is our Dana-Farber literature, and it recommends drinking a glass of quinine in the evening. It is important, it is important to say that you should stay well hydrated, and that will decrease the likelihood of muscle cramping as well. So it is important when talking about supplements to talk about why we don't recommend that you take a lot of over-the-counter supplements. There are a couple of studies that I looked at, and the truth of it is they can interfere with the metabolism of the chemotherapies that you're taking. The first study is from a physician out of Israel that looked at herbal medicines that are largely taken by people who live in the Middle East. They use a lot of herbal remedies. They don't necessarily talk about them with their physicians, and they can have a direct toxic effect on patients who are receiving chemotherapy. They can increase the availability of the chemotherapeutic agent in the blood. More isn't always better, and they can interfere with the metabolism as well and reduce the levels. So always, it's important to share with your physician or your nurse practitioner what supplements you're considering taking. They're not benign. They can have direct effects on the liver as well. There's another Spagnuolo, the second research looked at nutraceutical supplements, things you get over the counter in patients that were receiving therapy for AML. And he found, in looking at lots of different agents or lots of different things that people bought over the counter, that zinc, for instance, increased the efficacy of the chemotherapy, but that echinacea, go figure, echinacea interfered with the chemotherapeutic effects and blocked the effects of the chemotherapy. And not that we need to single out zinc and echinacea, but anything that you put in your mouth that isn't validated as appropriate by your physician or nurse practitioner can have effects on what you're taking, so always ask. So meditation is something separate even from yoga that's worth talking about. It's a mind-body practice that has a long history of increasing calmness, physical relaxation, and improving psychological balance, coping with illness, and enhancing your overall well-being. There are different elements of meditation. I can't teach you necessarily to meditate here, but a meditation should be practiced in a quiet location with few distractions, in a comfortable posture, typically seated with feet on the floor, hands in the lap, eyes downcast or closed. You should choose a focus of attention. For most of us, it's the breath, or a chant for some people, or a prayer. And the idea of the open attitude is that it validates that meditation is hard. You try to calm your mind. Ideas make their way in, and without going, I can't meditate, I can't do this. The theory of meditation is to stop, give yourself permission to have had that little slip, and then go back to the breath. So as you practice meditation, your mind will become more adept. You will be able to bring the focus to the breath, and it has a direct calming effect. I will admit that I don't like to fly, that I began to take medication to help me feel more safe when I'm in a plane, which interferes with how I feel, and I begin to breathe. So bumpy flight, close my eyes, take the breath, do a prayer, do a chant, whatever, focus on the breath, no drugs, feels great. Breathing is important. There is literature out there that suggests that meditation reduces stress. It reduces the secretion of stress hormones, which make you sick and can hurt your heart, and is likely to keep you healthier longer and happier longer as well. So I was thinking we might be able to do a quick meditation, but we're not going to. But there are websites you can go to that will begin to teach you how to meditate. There is a 5-minute breathing meditation. This is a US website, but I can access it here, mindful.org, 5-minute breathing meditation. And there's this lovely voice that tells you what to do and how to do it, and it helps you begin to understand. And there are also apps. You can put an app on your phone. There are 3 listed here. These are, again, US apps, but Omvana, don't know how to pronounce that actually, the Mindfulness app, which is the one I have on my phone, and Headspace. And you can use those at any time. And again, it's the voice. It's the voice that guides you through a breathing meditation, settles you down, and calms you. So, I don't know if I've gone over. I think it's pretty close to perfect. So take-home points. It's important to know why you're fatigued. We can't always answer that question. Drugs can make people fatigued. Disease can make people fatigued. Treatment can make people fatigued. So it's important that you undergo a fatigue workup before determining a way forward. But exercise is a well-validated intervention for the treatment of fatigue. And I really believe that the most important thing that I have said, possibly, is that exercise is an intervention that should be used for the treatment of fatigue. You will feel better. It might not feel better at first, but you start slow and you move forward and you develop an exercise program. Walking is good for your brain. Walk with somebody you love or walk by yourself. Be careful for the bikes, but walk. And it will improve your quality of life. Supplements, I think I made that clear, should not be used without consulting your oncologist. And meditation is a useful tool to reduce your stress and improve your fatigue. And your food should be real. It should be cooked and eaten, again, with people you love. And again, I want to thank the people that I work with as well. Dr. Castillo, who is a wonderful colleague and who has been teaching me about Waldenstroms, which I knew nothing about for the past year, and this really remarkable clinical research team that I work with. I have never seen a better one. Kirsten Mead and Joshua Gustine, and obviously Steve Trion and all the people that we work with in the Bing Center. Thank you.
So you were indeed perfect on time. So if there are some burning questions for Toni.
NCCN stands for?
NCCN stands for National Comprehensive Care Network. It's an organization that makes guidelines, recommendations for the treatment of cancer and cancer-related symptoms.
And these are public guidelines, so they can be used by everybody.
Exactly.
Okay.
Not good with the microphone.
So these are then, thank you very much for your session. we will have a short coffee break of half an hour, and then we will have the last sessions where you can be more active besides only taking up information. Please use your Ask the Doctor cards, and there's also a survey, I think, in your bag. So please turn in also the survey at the end of the program or already now what you would like to do. But the survey is very important to improve the program of the patient day. Thank you very much, and see you back at 4:30, please. 4:30.